Namaskar. We welcome you at Spiritual Doctors for Holistic Health. We have started this group long time back to have discussion on spiritual dimension of health, spiritual aspects of health, and holistic aspects of health. Dr. Sandeep, we are fortunate Dr. Sandeep is with us today. And so we will have some discussion session on mindfulness meditation. I am more into meditation. Dr. Sandeep is more into mindfulness. So, yeah, Dr. Sandeep.
सब दर्शकों को सब दोस्तों को जुड़े हुए हैं जो ऑनलाइन जुड़े हैं सबको मेरा सादर प्रणाम आत्म नमन. So as Dr. Ranjan said that he is more into meditation and I am more into mindfulness, I totally disagree with that. So both things are the same, just names are different, right?
Okay.
So no one is into no other thing. These are just nomenclature which differentiate the things. Otherwise, the root things are the base things are the same in every. Someone can say that I am into the Indian philosophy. Someone can say that I am the Chinese philosophy. But ultimately, things are the same. Ultimate purpose is the same. So mindfulness, meditation, and mindfulness are similar, and little bit differences are also there. Little bit technicalities are there, right? Mindfulness practices, you come to know that how to reach from point A to B more faster. Otherwise, anyone can do that. Right? It's not that I can do that and you don't know. I am practicing mindfulness, so you can't do that. I have been trained into MBCT, mindfulness-based cognitive therapy. You're not trained in that, so you can't produce that kind of results. It's not there. That I have learned the technique from point A to B. I can reach faster because I have been trained. You haven't been trained, but if you're on that path, you will also get efficient and proficient in that. Dr. Ranjan, today Dr. GK will also join us in the later half, discuss about the mindfulness and miracles of mindfulness. So let's do it in the question answer session, right? So let me ask you first. Uh, then I will answer that, then you can ask me questions, and that session will be unfold like that. So let's take it from our heart part, right? Let's answer from the heart. What is mindfulness for you?
Mindfulness, as I have understood so far, is being aware, becoming stay aware, awareness of surrounding, awareness of self. There are two aspects: awareness of self and awareness of the surrounding, awareness of your mind, what's going on in your mind. If you are doing some activity, so being aware of the activity. So mindfulness is awareness.
Great. So how we define that the mindfulness and how technicality is there? Like there are many techniques like body scan is there. There is 3 minutes breathing techniques are there. So we take three parts of our mind and body. One is the body sensations, whatever things we are experiencing, experiences in body. Second thing is the feelings and thoughts. Other things are the emotions. These are the three things one have to observe. Simultaneously, one can't observe all the things. So we give 1 minute to each thing. Like first, we will observe any body sensations are there. If there is some pain, some numbness is there, some tingling sensation is there, whatever is there, because mind, body are. So what for 1 minute we just get conscious and aware, be present and mindful about our body and body sensations. So for the second minute, we just observe the feelings and thoughts. What are the thoughts which are running in my mind? Just I become the observer. I observe my thoughts. What kind of thoughts are there? Are they thoughts of the past? Are they future or the present thoughts? Or thoughts, worrying thoughts or happy thoughts? And I don't get charged to any thought. I just observe my thoughts. Second thing is that. Another thing is the emotion. What emotions are there? For 1 minute, I just observe the emotions. Am I happy? I just label that emotion. Am I feeling happy? I am feeling sad. Am I angry? Am I neutral? There are different kind of emotions. I just observe those emotions. This is just an observation of body and mind and thoughts at three levels. When we observe in the present moment, we get more aware and conscious. and we are more aware and conscious about the things, we can change it in a better way. For example, if I have some sensation in the body, some pain in the body, I can take my breath to that part to heal that part. Even in the advanced stage, one thing is known as body scanning mindfulness. We scan our whole body and we send the breath and healing, the white light to that part and heal that part. Second thing is the thought. If we're aware about the thoughts, because our 95% of thoughts are unconscious, and those thoughts are like, it's not that we have the mind. Our whole body is a mind. That whole body has a memory. So every thought is stored there. So when we are conscious about thoughts, that affect our cells and body and DNA also. If we can change our thought, just become conscious that, oh, I am just taking the tension, and most of 95% thoughts are repetitive. Then I can work on that. Just getting conscious that this is not a reality. If I'm taking tension that I am sitting on the 34th floor in the building, what if the earthquake comes and I die? So this is useless thought. But sometimes these kind of thoughts are coming. So just get aware and tell to myself how foolish I am. So 34th floor, if the building collapses, with me near about 200% will be there, then I have the good cover. So I'm not alone. So this is just a lighter way. So third thing is the emotions. Sometimes we are not aware about our emotions. We just get the conscious about the emotions. So for me, and to go deeper, we can divide our mindfulness into three parts. Yes, fourth thing Dr. Ranjan has told, the environment. What kind of sounds are there? What kind of things are there? That is known as a movement or working mindfulness therapy, like or meditation. Right? I am sitting here. I am moving my head to switch off this light. My hand is moving like this. I am aware the direction, movement, and positioning of my hand, my body. What is the position of my body? What is the position of my back? What is the position of my foot? Where they are touching the ground? What is the weight experience of my body? What is weight of my body? Where my breath is? These mindfulness. Initially, they are difficult to observe, but as we practice mindfulness, it's very, very, very beautiful and healing modality. Dr. Ranjan.
Dr. Sandeep, intermittently some noise is coming from your end. Zoom में ऑडियो सेटिंग में ऑटोमेटिक नॉइज बैकग्राउंड नॉइज सप्रेशन का ऑप्शन होता है.
कहाँ पर होता है मेरे को आपको बनाना पड़ेगा होस्ट होता है
आप ये कोहोस्ट की बात नहीं है, ये आपका अपना पर्सनल सेटिंग है.
तो कहाँ पर जाना पड़ेगा आई एम नॉट टेक्निकल
लेफ्ट साइड में
मोर
जहाँ
में मोर
ऑडियो,
में
हाँ, नो
ऑडियो में
ऑडियो,
ऑडियो
ऑडियो ऑडियो सेटिंग,
ऑडियो सेटिंग ओके
ऑडियो सेटिंग, ऑडियो प्रोफाइल, थर्ड ऑप्शन, स्पीकर, माइक्रोफोन, बिलो माइक्रोफोन,
ऑडियो स्क्रीन
प्रोफाइल.
शेयर बैकग्राउंड इफेक्ट्स
नो, राइट साइड,
राइट साइड
स्पीकर, माइक्रोफोन.
spatial audio use separate audio automatically adjust the microphone background noise suppression
हाँ, बैकग्राउंड
ऑटो लगा हुआ है
नॉइज
इसमें
सप्रेशन
ऑटो है
ऑटो है.
हाँ
ऑटो पे नॉइज आ रहा है तो फिर आप हाई कर लीजिए.
क्या कर लो
बैकग्राउंड नॉइज सप्रेशन को हाई पे रख लें.
मीडियम में कर लो
नो, मीडियम तो हाई में करके देखिए तो.
Done.
सो इट विल. अब आपके बैकग्राउंड में जो खटपट हो रही थी वो अब नहीं आएगी.
Okay. Thanks for telling me. Though I am not a technical person, thanks for telling. But this is also mindfulness to how to use the technology. Yes, doctor.
So mindfulness and meditation are very much similar, they're very true, but little bit difference what is coming in my mind is that you got this book Lifestyle as Medicine, you know. It's a wonderful book. I request
Amazing, amazing book.
I request all of our participants to go through this book, Lifestyle as Medicine. It's available on Amazon. Free PDF has been provided by publisher. So that is another thing. So in the second chapter, meaning and purpose of life is there. And in that they have given three level of spirituality: spiritual transcendence, spiritual translation, spiritual transformation. Without going much deep, just contemplating on this concept, spiritual transcendence means becoming aware of something larger than you, larger than life, what we call higher consciousness in our normal term. Uh, God has not penetrated in the medical curriculum as of now, but the concept of higher consciousness or something transcendental, which is beyond our conscious self. So that spiritual transcendence is more being discussed more in meditation aspect. I feel so. What's your comment on this?
Totally agree, Dr. Ranjan. Because mindfulness based cognitive therapy and mindfulness based things like the techniques which are 6 weeks programs, they have been developed by the Western scientists. So they consciously avoided to use the religion and God and other things in their meditation. But these days, even they are using with a different name, right? They are using many names. Like for chakras, they don't use the word chakra; they use the word energy center. They know that they're talking about chakra, but they tell that chakra makes the people jump. They just cut off the community. They just divide the community. That is different. But you are absolutely. I totally agree with you, Dr. Ranjan, that mindfulness or mindfulness meditation. Let's take this word, mindfulness meditation. That getting consciousness, connecting with the higher self, going to the fifth dimension, taking the brain waves to the alpha state or gamma state, it's a different theory, is also important for healing purpose and spiritual transcendence. Right? To move from this 3D world to the, I can consider this world as a fifth dimension. Just technicality is different and things are same. So this is also important to experience the things, the mindfulness, that the connecting with the higher self, higher energy, your angelic God, your angelic spirit, whatever name can be any. This is terminology. But I totally agree with you on this part.
So, meditation, mindfulness, and meditation. In meditation, we are more concerned with the chakras and this spiritual transcendence, higher consciousness, higher self. So when we are very much clear to discuss about the higher consciousness or higher self, then there's discussion on intuition. Whenever we have to take any decision, if we can follow our intuition, then our decisions are always right. Means success rate will increase in every decision if we are taking our decision by listening our intuition. Oh, meditation is that much.
Totally agree. So when that intuitive power will come, when you will sit with yourself, it will not come that you are just busy in your small things, small life, worrying about the small things. Your morning is starting just like that. मतलब, आज सुबह खाने में क्या बनेगा? You're then you just go to that eating your lunch, doing work, doing the cup shop, using the phone, scrolling the reels, totally mindless, right? This is the most mindless work one can do. So, and you're going to sleep. And again, your same day starts again, and you like this same day. So, intuitive powers increase only when you sit with yourself. And sitting with yourself is also mindfulness, right? It's just terminology. You're just sitting in the nature. You're just listening the sounds around you. Just smelling uh, the flowers, you're aware about your body, what's happening, what sounds are there, how the air is moving those trees and shrubs and other plants. You're just observing them and you're looking at everything that this is part of cosmos and I am that. That's also connection, that's also mindfulness meditation. It's not that you have to sit in the quiet room, you have to go into the quiet place and no one should disturb, no sound should be there. So mindfulness meditation can be practiced anywhere, anytime, and not only with the closed eyes, the open eyes also. So that is the difference. Some like meditation concept in many person is that I will meditate only for 20 minutes, then my eyes will be closed. No, that you can be mindful for 24 hours, even when you're sleeping.
Hmm.
So, yes, Dr. Ranjan, I totally agree with this thing also, that what you said.
In
So,
chat, there is a good question by Dr. Sefali. Can we call mindfulness open eye meditation? So,
no.
yes, I am also on this statement that no. Why no? Kindly describe first.
So, let me describe it first, then you'll also extend on that. So, mindfulness is just open eye. I've discussed in the nature also, your eyes are open. Even as Dr. Ranjan have raised the point, when the closed eye, we are connecting with the cosmos, higher energy, our angels, whatever name your guide, boss I know, that is closed eyes, right? It doesn't mean that mindfulness practices are like body scan is a closed eye practice. 3 minutes breathing technique is closed eye. Walking meditation is open eye, open eye. Like you can't walk with a closed eye, right? You will hit someone. So there are many meditation with a closed eyes. There are many meditation which are open eyes. Our endeavor should be to remain mindful for 24 hours, right? So that's our saintly being. जब हम लोग अगर हम मेरे से पूछेंगे मैं 24 आवर्स माइंडफुल रह पाता हूँ नहीं क्यों मेरे को एक गुस्सा आया था बच्चों को अभी भी बहुत रेयर आता है मैंने बच्चों को पीटा नहीं आज आई एम वेरी प्राउड ऑफ दैट मैं आई हैव प्रॉमिस्ड माई सेल्फ दैट आई विल नेवर टच दैट बट सम टाइम आई गेट एंग्री थोड़ा पढ़ लो यार टीवी बंद कर दो यार एट दैट टाइम आई नॉट माइंड so it's a practice to go into the mindfulness on a bigger time, right? Today I am mindful 2 hours, then 3 hours, 4 hours. So you can give your marks that may 24 hours में से या 24 marks में से कितने marks आए. So right now I am at I think 3 4 marks, not a pass percentage also, but endeavor should be there 24. So answer is no. What about you, Dr. Ranjan? What do you say that it's closed eye, open eyes, or
To discuss about this concept, I would like to share discussion on of brain wave. So when our brain is alpha, we can call it mindfulness. To qualify some state as a meditation, in Patanjali it is yogasya chitta vritti nirodha. Means your thought need to be still, zero thoughts. If we can translate that as a brain wave, then it will be 0 to 4 hertz brainwave state, that is delta state. Because as of now mindfulness and meditation are not very much segregated, these words are being used interchangeably. So at some places even alpha state is being called meditation. That's fine. It is mindfulness, that is awareness. It can be practiced with the open eyes, but being in delta state with open eyes are a very high advanced feat. Means Swami Rama demonstrated voluntary control on ANS, autonomic nervous system. So such people like Swami Rama can go in delta with open eyes, but for a meditator like me, I can go in gamma by will. Means I think so. I have to undergo EEG or using the Muse. But whatever the technique is there on about gamma or delta, that being still, being calm, is no thought state. After a little bit of guided meditation or what I practice, breath mindfulness, observing the movement of breath and the space between breath, I can go in delta easily and I can stay as long as I wish to.
okay.
So
And
meditation,
let me add this thing that what Ranjan said that going into delta is very rare, right? Matlab, if we take the population that who is experiencing those delta waves, so or not delta, the gamma waves. So gamma waves they are very rare. Right? Going to delta, it's like meditation going there. Then within the spaces there are you can go to easily if you have regular practice. But there is something known as let me explore that the first wave that which is a gamma which is more than 30 hertz, 200 hertz or more than that. So they are the high frequency waves. So even when you are in the gamma state, that state causes the healing in the body, and that's it, that you can experience the mystic experience within that. So in that state, you can that you must have heard about that. Many persons I am very sure that who are the regular listeners of our talk shows. that my father was in front of me who died 10 years back, and I could talk to him. I experienced that. It was real. How that real? That you could, someone can say that I could see the colors and I could smell few things that was there rose around me, or someone can say that oh, I could see the mandalas. There's a beautiful mandalas were there. They're moving like that, and these all experiences are real. Let me tell you. When we are in the gamma state, that state can be achieved. Only few persons on this planet can achieve that. For the person who has a Kundalini awakening, a Kundalini experience is there, they can experience that. For them, there is something regular. And let me tell you, the person who experienced this thing in a mystic experience, they don't share with other person. The past was there. They were not sharing anything with anyone because this was their own thing. They just want to own that experiences. And they taught these things only to few persons. But the science has made it possible that any person can experience that gamma state where you are totally healed. That it's a deep kind of meditation, and anyone can practice this, and anyone can experience this. And it's not very difficult, but only intentions and surrender is needed. Right? Belief, surrender, and intentions are needed. These two things are. So
Hmm.
one more question has come, Dr. Ranjan, that Dr.
Yeah,
Shivani has asked.
let me elaborate more on this point,
Correct.
because lots of discussion are happening on the topic of lifestyle medicine, and I am also encouraging it because at least science is discussing these aspects of medicine, these aspects of health. But when we will dive deeper, then deeper aspects of spiritual dimension of health will pop up. So as of now, lifestyle medicine covers meditation as a part of stress management. So yes, it has been included, and it helps their lifestyle medicine community is accepting meditation as a treatment modality, but not as a standalone, but as a part of lifestyle. But when we are discussing here the meditation and mindfulness, so if our focus is just stress management, then mindfulness is enough. Mindfulness is fine. But when we'll go in deeper discussion that instead of mindfulness, let's dive in meditation, that is delta and gamma brainwave. Just now we have discussed, and in delta and gamma brainwave, there is feeling of energy centers, activation of energy centers. So when we will go in delta and gamma, and we have our energy centers getting activated, then the medication effect of meditation will be deeper. It will be more profound. So lifestyle medicine community need to understand this mindfulness and meditation part, and for that I thought of including this here.
We can take Dr. GK's view on this, that
Yeah,
on the brain waves and mind. So Dr. GK is with us from France today. Is connected. So a great doctor and pyramid meditator.
Dr. Gagan is also here. If he is comfortable, then
Yes,
will also add.
Dr. GK, if you can just
In fact, we will invite any doctor
everyone.
who is a practicing medical doctor here. You are welcome to share your opinion on this concept, mindfulness versus meditation, or anything whatever you feel to share.
Dr. GK.
Yeah, basically, so these two we have to understand. One is the state, and the other one is the process. So this difference, first of all, we have to understand. One fits to the other. So mindfulness can be a part of the meditation because meditation is the one where we reach that complete calmness through the practice, whereas mindfulness is a state which comes as a part of meditation. So clinically, to attain deeper levels of healing, one should practice meditation, and through which we can gain that major part of the energy, and then we can connect to the higher dimensions so that we can position ourselves according to our purpose. Whereas mindfulness uh, by having practicing those 7 basic pillars like non-judgmental and having patience, and then you know, like earlier you said, the beginner's mind, which is open to different thoughts, and believing or trust someone, so that we can calm the mind, and non-striving, acceptance, and letting go, which we practice. So these are the basic 7 pillars, which gives us the mindfulness, so that we can control our mind, and then we can maintain the living in the moment. So
Thank you.
these two, yeah, has to understand in that way. Yeah, thank you.
Thank you, Dr. Ji. So, Dr. Ranjan, what is your comment what Dr. GK has said?
Yeah, true.
Dr. Gagan, if you have any input on that.
Okay, regarding differentiation of mindfulness and meditation, I am not into state that I can comment. But one thing is clear to me that there's depth of awareness. That awareness is so vast that when more we go into awareness, more we know that we are not aware at all. So, talking about meditation, I think complete meditation is that we are fully aware. When we could have, we can say that we are aware, but there are much more deep waves of awareness, I would like to say. So, more I become aware, more I know that I am not aware at all. This is what I can say on this topic.
Thank you for sharing, Dr. Gagan.
So now this is going into Carl Jung has explained the concept of unconscious mind. So subconscious and unconscious. The more we are becoming aware, more we are aware that we are something for which we are not aware.
I told everything is connected. Like from here, mindfulness, we can reach to the car then. So ultimately, the things are related to each other, but the nomenclature is different. At different parts of different times and different kalas, the things have been explained differently, right? The nomenclature was different, but the essence is the same. Like if the rose is there in the Kali Yuga or Treta Yuga, the name can be different, but it will be red. The smell will be same. The use will be same, nearly same, right? So meditation and knowing yourself, who am I? These are the two things which I'm observing from the time when the humans start using the language, because only language we can communicate. Sometimes I feel that I don't know that right now, just sharing my thoughts. Sometimes I feel that when dogs is they're sitting there and enjoying the weather and they're dancing, they're fighting in the morning, they're just doing different kind of work. They're also doing mindfulness meditation. I don't know that I'm right because I haven't asked any dog till that I don't know their language. But I can talk about the humans when the language started. They can converse, they can tell that this meditation is this is my question, who am I? That from the literature also, that from even different, we take it Chinese literature, take it any Egyptian literature. Major question was that how I can meet the God? Who am I? What is my purpose of the life? Like when one goes deeper into this spirituality, these are the major questions everyone has gone deeper and deeper into and found the gold mine, diamond mine. So I think this is a basic question and terminology is different. So that's why we are moving from meditation to mindful meditation to spirituality to the fifth dimension and to the Karjan. So that shows that things are same. Dr. Ranjan, is it good time that we can share that what we were sharing before the session?
Okay. And that will be totally different topic.
That's not different topic, but I will touch it in the same scenario. that myself and Dr. Ranjan were discussing about what's happened on the mainstream media day for yesterday. That Navjot Singh Sidhu and Navjot Kaur Sidhu have done the press conference and they have shared that we have been healed and and I am totally free from the cancer because I have used meditation, I have used the alternative things, I have changed my lifestyle, I have done the intermittent fasting and other.
Hmm.
So this is truth. It's a personal truth, and that's the reality for that person also. That and 262 oncologists have written a letter that whatever things he is talking is all bullshit. So don't follow these things. So and when I shared that thing in my medical college group, when I was in medical school, we have one group there, and there was a lot of voices. I was a lone voice. But in the end, I send them more love that we should not defend our pathies. Our main concern is our client, our patient, a human being, that how he or she is going to be treated. So we have to follow the other things also, and we should be open for other things also. That this is not that with the horses that we are looking at this right. So similar way that mindfulness and these meditations, because mindfulness techniques are scientific, so world is accepting them. Progressive relaxation, lot of study, lot of papers have published. That's why people are accepting that. But that transcendent meditation, that other things, few studies are there, only few studies are there, and they are not even in mainstream. So the purpose of spiritual doctor platform is to take these studies, scientific studies, and the personal experience, and to share with the bigger population. So even if few scientific person, and one question was more there, that okay, you have treated one right now in three patients who are totally free from cancer. Right, one patient is going on. So they told that even to diagnose, even to tell that person is free from cancer, you have to take the help of the medical doctor. So I told them taking the help of medical doctor or using the scientific techniques or instruments does not mean that this is the forte of one person. Any person meditation should also use scientific. So one thing for many doctors, I'm sorry for that, not all the doctors, because Pareto's rule is there, 20/80 is there. Today, 20% person are this side and 80% are on the other side. That they think that Tulsi, Haldi, these things are only medicine because they think about in the concept of holistic health and medicine. So there is one big thing which is mindfulness, which is meditation, which is missing as a medicine. Meditation as a medicine is missing in medical field. And that thing should be added and must be added and scientifically should be added. So I just want to add that, Dr. Ajay, so we can take deeper.
I think we should go for the some practical part, some
Yes,
practical
it's
session of
11:44 is there. So, Dr. Ranjan, I think let me start with the 3 minutes breathing.
okay.
I will tell the whoever is there to experience that mindfulness. After that, I will invite you to take the person who are there in this meeting to the alpha state and to deeper gamma state for that.
Dr. Sandeep, can I speak a word?
Yes, may I know
This
your name and
this is Dr. Kamakshi.
hi, Dr.
I,
Kamakshi, how are you?
I'm good. I'm good. And
So let me tell, Kamakshi is one of my batchmates, so she was also in group. So
yeah, I like I am in full support with you because whatever you were saying in that group also, that was practical, and even I've observed people getting rid of this cancer by doing alternative therapies. But the problem is that we have very little data. One of
yes,
my friend now, when I was traveling, I met a person who was a publisher of Wiley. He was the chief of Wiley. So हमारी books नहीं आती Wiley की. He was the main publisher, and he said कि they were doing a study that Alzheimer's is more common in US as compared to India. So what is the reason for that? And when they did a review of these, they took 2000 people and they reviewed that in India the reason for less Alzheimer's is because of the herb which we are using in our food, and that is turmeric. And if they found that turmeric is maximally used in Indian population, so the instance of Alzheimer's is less as compared to US. So there are certain things that we cannot negate them, like Ayurveda, the other allopathies, which are far ahead of allopathic medication, but people are not aware of it. So when I heard that discussion, and I was wondering that only one of the person was very aggressive, that he did not want ki, yes, we should go ahead with this discussion. And moreover, sometimes like my one of my auntie, he's 74 years old, and they wanted to give chemotherapy to that patient. So there are certain things in which we need to step back and just think that whether this person wants to live a better life, because chemo just enhances the bad effects of the tumor also. Matlab, it is not a proper treatment, I will say. Certain things else has to be done. And I've got confused with this mindfulness and meditation, because for my thing, what Dr. Ranjan used to tell, mindfulness is mindful living, like what mindfulness is mindful eating. When you are eating also, then you should be mindful. When you are living also, then you should be mindful. And meditation is going into deep level of your consciousness. So I'm not clear about that concept, just getting confused about it.
Uh, no need to get confused, Dr. Kamakshi. Whatever you have understood earlier before this discussion started, your understanding is fine. Meditation is going deeper. Meditation is going deeper within self. Meditation is going deeper in consciousness.
Hmm.
In mindfulness, there are very little discussion on consciousness. In meditation, there much discussion on consciousness.
Yeah.
So, mindfulness is more popular in research field,
Yes.
but in Indian context, meditation is more popular, and meditation has deeper effect, deeper impact.
Thank
Thanks for
you.
sharing,
Thank you.
Dr. Kamakshi, that beautiful research about the Alzheimer's disease and the use of that.
Thank you. I really like this group. Thank
Thank
you. Keep it up. Thank you.
That thing is that we have to spread that awareness. That's why we are here. That's why we are in the minority right now. But one day that time is not far away. And because when it comes to you, that you want to use everything. Right? When my father was in hospital and he was in ICU, right? At that time, I was in touch with Kamakshi and my other batchmates and my seniors and everyone, because that is your loved one. I have Reiki healer also who was there to heal my father. I was having a craniosacral therapist who was coming daily to give the craniosacral therapy to my father. So I was giving sound healing to my father every day, and we were doing a prayer therapy every day. So what are things you have, and we are doing that Ayurvedic things also. Whatever, so few things doctor have not allowed us in the ICU, that we don't allow these kind of things to patient to eat, but these things are external. They allowed us to use all the therapy. So um, I know that in the emergency medicine, our allopathy is one of the best. No one can beat that. Like if my hand is injured, I have to take antibiotics. I have to put the stitches on that, and no one can beat that. But there are other things also. We have to open for that. We have to experience those things, right? That's the reason there are a lot of things we have discussed, and we have to discuss. So let's go to practical things, right? Melody, how to check.